Hello, I'm Dr. Daniel Griffin,
I'm Dixon DePommier.
and today we're going to be discussing pharyngitis,
Right.
the sore throat,
The sore throat.
the bane of my existence as a child.
Listen, it's got a rich history of iterations that this caused it, this caused it, this caused it, and finally there are now multiple causes, but there used to be a real serious one that
Well, I think the biggest worry we have as clinicians when someone comes in with pharyngitis is Group A streptococcal pharyngitis.
exactly, you're right.
So GAS.
That's what I was thinking.
And this does have a rich history. The first attempts to establish antibiotic durations
Right.
go back to streptococcal disease, where they would suggest a certain duration and then study, do we do 10 days? Is it 7 days? Is it, whatever?
This is the strep throat syndrome.
And that's what you're worried about. You're worried about, I think many parents throughout the world are familiar with bringing their children in to determine and to find out,
They had scarlet fever.
does my child have strep throat?
That's right.
And why do we care? Why do we care?
Well, because it can develop into something else even more serious than strep throat, right?
True.
Bacterial endocarditis.
So it's interesting. It's not actually an endocarditis initially. It's a rheumatic heart disease.
I'm sorry, I meant to say that.
Actually,
I meant to say that, actually.
No, I appreciate you doing that on purpose for me.
My Rolodex turns slowly.
Because there's a couple different complications of untreated
That's right.
Group A streptococcal infections.
Yeah.
And one of them is rheumatic heart disease,
Yes.
where there is a certain protein on the surface of strep called an M protein, and the immune system targets the M protein, but it's close enough that the immune response ends up attacking the heart, causing damage to the heart valves, which then puts people at high risk for endocarditis. So ultimately, yes. So ultimately can lead to endocarditis.
It's interesting because historically speaking, I spent my not misspent youth as a postdoc at Rockefeller University. And at that university was a group working on the cross-reactive antigens between Streptococcus group A and the heart valve, which obviously becomes involved in this eventually.
Yes.
And the man's name, as I recall, was Zabriskie, and he had a group that was all working on trying to isolate the antigens and show what they had in common so that they could develop vaccines and that sort of thing to sort of prevent that from happening, right? So I have a lot of early knowledge, but it's totally out of date now, I'm sure.
Well, no, that's okay. So, that's one of the critical, when someone comes in with pharyngitis, much like, the other cases we've had, the other talks we've done, is we're trying to determine, is this a serious concern? Is this a Group A streptococcal pharyngitis with the potential for the rheumatic heart disease, but also a kidney complication, glomerulonephritis, where the antibodies that are produced instead of cross-reacting to the heart are going to be produced in such a magnitude, they're going to complex and they're going to damage our kidneys. So majority of cases of pharyngitis are viral.
Are they?
What we're trying to determine is what minority of people who present with pharyngitis have Group A streptococcus and require treatment. Because as we've discussed, not only are they at risk of these potential complications, but what do people with diseases do? What do we all learn in kindergarten? We learn to share.
Yes. I do remember some rather riveting movies that sort of played into this. One was Ferris Bueller's Big Day Off, and he faked his pharyngitis by actually taking the thermometer and holding it up to the light bulb so his temperature would go up, and then quickly put it back in his mouth as his mother walked in. Oh, yes, you should stay home from school today because we don't want you to share this with anybody. So that was the theme of that particular movie, and I know that's trivial.
No, actually, that's good that you bring that up, because when we're trying to make this how are we going to make this distinction between a viral pharyngitis and a Group A streptococcal pharyngitis that can have life-threatening complications? And this is a challenge that goes back quite a bit. And in a place with a lot of resources, what you can potentially do is rapid testing.
Sure.
You can swab in the back of the throat, and you can look for antigens. You can actually detect strep antigens and rapidly. You can do cultures. I don't know if people remember this growing up. You get swab in the back of the throat, and it gets spread, and then you're waiting to see if it grows streptococcus.
Sure.
But one of the first things that we do often before the diagnostic testing is we're looking for signs and symptoms that can give us a predictive value for whether or not this is requiring antibiotics or whether it's viral, where all antibiotics are going to do is create harm and resistance and side effects. And a couple scores were produced, and so one of them is the Wachstum scale, or the Wachstum score, and another is the WHO simplified pharyngitis approach. And so let's walk through a little bit about the Wachstum score, because I think this is helpful for clinicians. And this probably new for you, I would say.
Oh, I'm learning every minute here.
Okay. So for those of you watching, this is going to come up now, so you'll get to see this as we go through it. But for those of you listening to this, the audio version, one of the first point areas in this score is age. And the age is a little bit interesting here. There's a certain peak period of time when people become at risk for group A strep pharyngitis.
Okay.
So in the first 3 years of life, if you're less than 35 months of age, then you're at lower risk. So you only get 1 point. Points are bad here. This is like golf. Anyone plays golf, the more strokes, the more. If you're between we'll say 36 to 59 months, then you're going to get 2 points. And then if you're over 60 months, right, that's about, if you're over the age of 5, up until 15, then you're going to get 3 points. When you get to the age of 15, so 15 to 45, the incidence of group A strep actually goes down quite a bit, where you get a 0.
Interesting.
And above 45, this is sort of a modified, you actually subtract, you get a -1. So the peak incidence of group A strep is right at about 5 to 15 years of age.
Interesting.
That's the peak risk also for complications.
Wow.
But then as you may be, I think you're over 45. So you may be outside of the risk zone. You may not have to worry.
I have like a -100 points in my favor here.
So the next area where you're going to get your points are the lymph nodes. We say the tender cervical lymph nodes. So cervical meaning neck, and these are going to be the lymph nodes in the front of the neck. And if you're able to feel the lymph nodes and they're tender, that'll give another point. Headache, interesting enough. Headache is quite common. The majority of people with group A streptococcal pharyngitis will have headache, less common in people with a viral pharyngitis. The next is if you look at the palate, so this is going to be the roof of the mouth. With group A strep, you'll start to see petechiae, which are little dark red dots.
Yes.
Okay?
Yep.
Abdominal pain. I mean, here's somebody coming in with pharyngitis, but they've got abdominal pain. Again, you get a point. That's quite common with group A streptococcal disease, because it's actually a systemic infection. It's not just localized. So they will often have abdominal pain as well. The other is onset. Viral pharyngitis is more gradual. So if the onset's very quickly.
Pardon me?
Actually, I love that you coughed, because cough.
I can do that again, actually, if you like.
Cough is actually a negative predictive value.
It's reflexive.
If someone comes in reporting cough, that decreases your suspicion for the pharyngitis. If they have conjunctivitis, if their eyes are red, if they have runny nose, if they have what you might think of upper respiratory infection symptoms.
What about pain and swallowing?
So that's not actually in the scale, though I think that's a common thing that you would.
Because I'll demonstrate that I don't have any.
So you drink without causing pain. Now the WHO has given us a simplified approach, and their simplified approach ends up treating less, because if you look at the Joe Kim score, you're going to basically, if you say less than 2 versus greater or equal to 3, that's going to be our cutoff. So if you're going to get 3 or more points, then you're going to start being more concerned about group A streptococcal pharyngitis.
Right.
And at that point, you're either going to trigger an antigen test, a culture, or maybe treatment. The World Health Organization has a simplified approach, and they're going to recommend that all children who have the pharyngitis, looking in the back of the throat, seeing inflammation, you also see exudates back there, and you see cervical lymph nodes. They're going to say if you've got all three, you should treat. If you don't have all three, you shouldn't treat. And so the sensitivity is going to change depending upon which criterion you're using, and the amount of antibiotics you're going to be dispensing is going to change accordingly.
Interesting. It brings up an issue about old world medicine versus modern medicine. I fall into the old world medicine category as a child, and most children of my age group have undergone tonsillectomy.
Yes.
And a tonsillectomy was a trauma. I can remember the nightmare that I had under ether anesthesia as a child. And they have removed several of my lymph nodes whose job it is to protect my throat from pharyngitis, right? But they can become inflamed, and they can become supra-infected. And then that was a clear sign for the clinician to reach in there and pull them out. And then you could have all the ice cream you wanted to eat afterwards, and you didn't want to eat anything afterwards.
There were scalpels involved in the
apples! Oh, that was cruel. That's cruel.
But I think this is good. Let's talk about treatment. Was that the right approach? Do people with pharyngitis do they need their tonsils removed? Is it a good idea? How should you approach this?
That's not the cure for strep A.
So let's talk. So we've made our diagnosis. We've either, in the majority of cases, determined that this is only viral. We've not given them the side effects and risks of antibiotics. But now we have individuals who actually have confirmed Group A strep pharyngitis. So what do we do?
Exactly.
One of the tremendous things about Group A streptococcal pharyngitis is the organism cannot produce what are called beta-lactamases. So it cannot produce the enzymes that break down our penicillins. So here we are in 50, 60, almost 100 years past the introduction of the penicillins. And Group A streptococcal disease is still sensitive to penicillin.
That's remarkable.
Good old penicillin.
That's remarkable.
So there's no need to use azithromycin or clindamycin or some of these other antibiotics, which actually Group A streptococcus has become resistant to. You want to just actually use penicillin, VK, or amoxicillin. And these are effective. And the durations I talked about, this is where we started first looking at our durations. And so the people will now see, if you're watching, you'll get to see our recommendations. But the penicillin VK, V is actually the Roman 5. So it was like the 5th preparation of, we always think it's the Viking form, but it's actually the Roman numeral number 5 penicillin.
Wrong invaders.
Exactly. So in children, it's weight-based dosing. And then as you get older, but it's going to be 4 times a day for 10 days. And that's a duration that's been shown to be associated with efficacy. If you do amoxicillin, that might be 3 times a day, but again, it's going to be for 10 days. And in some cases, people will actually use the injectables. So we have choices here. What do we do when someone's penicillin allergic?
Well, you're going to have to switch antibiotics, I imagine.
Yeah, the first thing I do is I moan and I ask them, "Are you sure?"
Yeah, right, sure.
Because most of the time I don't want to believe them. It's going to make my life complicated.
Exactly.
And I often get things like, "Oh, when I took that antibiotic, I didn't like the taste. When I got the injection, it hurt."
Right.
Yeah, and so I want a little bit more before I will move away, because these medicines are so effective. And so that's when you might consider azithromycin. You might consider alternatives.
Got it.
But what about surgery? That's what brought us here. There still are situations where individuals continue to have repeated tonsillitis, repeated pharyngeal infections, and in those cases, surgery to this day is indicated in all settings, whether you're in an area of the world with limited resources, in a rural area, or whether you're in a major cosmopolitan city. There are certain individuals who are better off undergoing a tonsillectomy than continuing to get infections.
And there goes Wharton's circle of protection, as I recall.
Exactly,
remembering it.
exactly. That
That's-
is the lymph node chain that
That's
protects
exactly
our,
right.
that protects our throat.
So now what happens?
Well, in most cases,
Do the numbers go up
hopefully,
then the older you get?
as far as
Strep A?
no, the nice thing about Group A strep is that once you get outside of that range, once you're older than 15,
Even with the tonsillectomy?
even with that, and the nice thing is with the lack of, so we think of it as a protective circle,
We do.
but in a lot of ways, it can actually be a place where the pharyngitis thrives. About 1 in 5 younger individuals under the age of 15 have chronic streptococcal pharyngeal colonization that will periodically turn into infections.
That's crazy, isn't it? I mean,
And so
here's
that's a challenge.
These are the things that should be protecting you, and yet they're giving you the problem.
And they can form scarring and crypts and little areas where
Yeah,
the
and
strep can.
I've seen the pictures of those
Yeah.
things. It's not pretty.
Yeah.
Not pretty.
But here's actually, why don't we see as much rheumatic heart disease in the United States as we might see in sub-Saharan Africa?
I'll bet you're going to tell us.
Well, fortunately, it relates to a lot of the stuff you were researching on, is that the strains that had the particular M protein, the rheumatic strains,
Got it.
are very rare in the United States.
Interesting.
And they're still, unfortunately, quite common in a lot of areas of the world.
The group at Rockefeller was working with a group in Egypt, and that was their target area. And I presume that they had a lot of adult mitral valve failures as a result of bacterial endocarditis and that
Yeah.
sort of thing. So
Yeah, and so actually this figures in when someone comes to see me or there's a case where there's an individual who has strep pharyngitis and they're from, an area where there's not a lot of the rheumatic heart disease strains, the risk is going to be lower. If they tell me I just returned, I ended up with a horrible case of strep pharyngitis after spending about a month in southern India. And I was actually a little concerned because I knew that was an area with a high rate of the rheumatic strains. of
And by the way, he's
Streptococcus.
clearly over the age of 15. I must tell you right now that
Yeah.
even though he's much younger than I am, he's well over the age of 15.
Mhm.
So
This is true. This is true. And so we won't talk as much in here, but unfortunately, if you don't do a great job with your Group A strep, even when you do, I think as good a job as you can, there will be a number of patients who end up getting the complications,
Yep.
and they'll have damage to the mitral valve,
Yes.
potentially the aortic valve. Mitral is the most common.
Yes.
They may end up on lifelong daily penicillin to prevent them from recurrent damage.
I knew someone, the wife of a colleague of mine, who as a child developed rheumatic heart
Rheumatic
problems.
heart disease. yeah.
rheumatic heart disease, and had a mitral valve replacement using a pig valve. And that had to be replaced twice during her adult life. And those were not trivial operations.
Yeah, and you can imagine in a lot of parts of the world, individuals with mitral valve damage,
Yeah.
the ability to access a valve transplant,
No,
it's
just not
quite
going.
something.
It's
So
not going. Even with modern medicine the way it is, I mean, she developed, unfortunately, a clot during the operation and developed a hemispheria.
okay, hemiplegia, so paralyzed on half the body. Yeah,
Hemisplegia.
yeah. So
And-
it's amazing what a huge impact we can make on an
Absolutely.
individual's life, on a community by appropriately treating the people with Group A streptococcal pharyngitis and not over-treating people who might have viral.
So is there anything to prevention to avoid all this?
Well, I think one of the big things is to treat people when they have it, to try to
keep it
prevent
from
the
spreading.
spread through the community.
And what about herd immunity? Is that, there's no vaccine
People
for
will
this, right?
people will continue to get Group A streptococcal
Yeah, there's no
pharyngitis.
vaccine.
So no, there's no vaccine that specifically
That's
works
too
on
bad.
this.
That's too bad.
All right.
Okay.
Well, thank you for joining us again
Yep.
on I'll call it Group A streptococcal pharyngitis.
See you next time.